A little bit late start here. Normally we have Facebook Live at 4:45 on Fridays, but we got a little bit of a late start here. So today's topic is going to be on eye health. One of the things that I like to stress about to all my patients is about the importance of yearly eye exams. Now, a lot of times patients come in because they have some sort of a vision problem, but we want you to come in every year just because we want to make sure your eyes are healthy. Because if something's going on inside your eyes, it doesn't matter what you put in front of them. So a lot of times people come in because their vision isn't very good, and that's a very understandable complaint. But once again, we want you to come in because we want to make sure your eyes are healthy, because if something bad happens to them, you got to fix the changes before you lose your vision, because once you lose it, it's gone. And once it's gone, it doesn't matter what kind of glasses or contact lenses that you're wearing. So what I wanted to just show you today is a little bit about what we do before we actually meet the eye doctor. Once again, my name is Dr. Theodore Sees, and this is Rockford Family Eye Care. Right in this room here is our pre-test room. So this is where we do a lot of our preliminary stuff before we actually go in with the eye doctor. There's a couple of machines that we have here that are really key. This first machine here is called the autorefractor. What it does is it sends a light into your eyes, and the amount of light that comes back in the machine gives you an estimate of what your prescription is. And usually the prescription is based upon the shape or the size of your eye. So if you're nearsighted, that means your eye is a lot larger than the perfect sized eye. If you're farsighted, your eye is actually smaller. And astigmatism, everybody's heard that word before, that usually just means that your eye is more shaped like a football. That's usually, or the main reason why somebody needs a pair of glasses. It's mostly because the eye is not the perfect size or shape. This machine here is a really cool machine as well. This machine takes a picture of the inside of the eyes. Now, the inside of the eyes is very important because that's where all the images are gathered and sent to the brain. It's a very delicate part of the eye. The front part of the eye is very important too, but the front part of the eye heals very nicely should there be some sort of trauma. The back of the eye, usually there's some scarring that occurs or that can occur, and once a scarring occurs, you never get your vision back. So this machine here will take a picture of the inside of the eyes. It'll help me see, like I said, all the tissue that it's where all the tissue absorbs all the images and sends it to the brain, but it also allows me to see where I can look at eye diseases, including glaucoma, macular degeneration, retinal detachments. Right up here is a picture of the inside of the eyes. A lot of people have no idea what the inside of the eyes looks like, but it's a pretty remarkable structure. This structure right here is the nerve that connects the back of the eye to the brain. When we look for glaucoma, that's the part of the eye that we're looking at. This darkened area here is called your macula. It's heavily pigmented because majority of the light hits that spot right there, and it gives you your 20/20 central vision. We also look for macular degeneration when we look at that spot of the eye. These lines here are the blood vessels that supply blood to the back of the eye. What's cool about the eye is the only structure of the human body where we can look into and see your optic nerve or nerves and blood vessels without cutting you open. So not only can I see eye diseases like glaucoma or macular degeneration, but I can also see early signs for systemic conditions. A good example is diabetes. Everybody knows somebody who has diabetes. Well, what can happen with diabetes is the blood vessels can become leaky. And so what you'll have is you'll have bleeding along the blood vessels on the inside of the eyes, and it'll show up in the picture here. So what I'm trying to express today is that going to the eye doctor is so much more than just glasses. You can get a good representation of what's going on with your whole body. The average time that somebody goes to the eye doctor is once every 2.5 years. And not that there's anything wrong with, it's really important to get your teeth cleaned every 6 months. Totally understand that. But what would you rather lose, your eyes or a tooth? So I guess my main thing is get your exam every year and just make sure your eyes are healthy. You do not have to buy glasses every year. A good pair of glasses should last multiple years. So the quiz question for the $5 Big B gift card is, according to the American Optometric Association, how young are you, or when are you supposed to have your first eye exam? By what age are you supposed to have your first eye exam? This is kind of a tricky one. Use your phones, Google it, look up the American Optometric Association. Once again, I'll repeat the question. According to the American Optometric Association, at what age or by what age are you supposed to have your first eye exam? First person who gets the answer correct puts it on Facebook, will earn a $5 Big B gift card. Good luck, guys, and I will see you next week at 4:45 on Friday.